Hello everyone, and welcome back to my channel. This is the Optical Journey with Halia Kayat. In today's video, I'll be talking about an eye condition that is seen to be normal, but it's not normal. Before I get to the topic of today's video, I'd like you to click the subscribe button below this video. Have you? Okay, so let's continue. So the topic for today's video is PTOSIS. Yeah, the spelling starts with P, but the pronunciation starts with T. So it's PTOSIS. What is PTOSIS? PTOSIS is actually the drooping of the upper eyelid in one or both eyes. The drooping eyelids may either be barely noticeable, or the eyelid may cover the entire pupil and interfere with the person's vision. PTOSIS may actually be present at birth, which is known as the congenital ptosis, or it may occur later in life, which is known as the acquired ptosis. Droopy eyelids more often affect older adults as a result of the aging process, and according to research, congenital ptosis occurs in 1 of every 842 births in the United States. This means that out of 842 births, there's definitely 1 or 2 ptosis babies. The most obvious sign or symptom of ptosis is a drooping eyelid, as I said earlier on. And a drooping eyelid can affect one or both eyes. It depends. And it all depends on the severity of the eyelid droop. People with ptosis may have difficulty seeing with the infected eye. Sometimes people tilt their heads back and try to see under the droopy eyelids, or raise their eyebrows in order to see. Ptosis due to aging usually occurs very gradually. The causes of ptosis can be chalked up to the problem with the muscles that lift the eyelids. These muscles are called the levators, and this may be due to a nerve problem, a trauma, or other underlying causes. In some cases, ptosis can also be caused by a growth or a sty on the eyelid. Children may also exhibit ptosis symptoms because the levator muscles responsible for opening the eye are not fully developed or completely developed, and over time this compensation can lead to issues with the head and neck because they end up tilting their head backwards in order to see things very clearly. In older individuals, age and excessive eye rubbing can lead to stretched or weakened eye muscles, resulting in ptosis. In rare and unfortunate cases, ptosis can be a sign of stroke, brain tumor, or cancer of the nerves or muscles. Treatment for ptosis depends on the severity of the condition and the preferences of the patient. Many cases of ptosis are minor and they do not negatively affect the individual's sight or health. However, those whose vision is impaired by the condition will likely require a ptosis surgery. This is a procedure that usually involves tightening of the levator muscles and sometimes removing the extra skin in the eyelid. In rare circumstances where the levator muscles are severely weak, the surgeon may also perform a special procedure that enables the forehead muscles to help the levators lift the upper eyelids. So sometimes they will lift the eyelid, and sometimes they might do something to the forehead to help, And how risky is a ptosis surgery? Because I know if you hear surgery there, you'll be like, hey, surgery there, how can I stand it? What if the thing touches my eye? What if no, it's not going to touch your eye? And the risk involved is not anything so severe that is going to affect your eye. It's just maybe a look. Okay, so after the surgery to repair the ptosis is done, the upper eyelids may not appear symmetrical even though they are higher than they were before. Rarely some eyelid movement may be lost. But before agreeing to a PTOSIS surgery, ask the surgeon how many procedures he or she has done before, and then also ask to see the before and after photos of previous patients, and ask if you can talk to any of them about their experience. So yes and no. You might be wondering what the question is and what am I answering. So can PTOSIS be cured? Yes and no. PTOSIS surgery can restore your droopy eyelids, alright, and to a more normal position. And the effect of the surgery is usually long lasting, But however, after a number of years, some eyelid drooping may return. And when do you have to seek help when that happens? While the droopy eyelids are usually harmless and they do not cause for any alarm, there are certain instances in which the eye doctor should be seen promptly, to know of certain things about your drooping eyelids. Maybe the surgery has to be done again or something. It is also very, very, very important for parents to observe their baby's eyes to see if there are any eyelids that look uneven. If their eyes appear to be two different sizes, or if they frequently tilt their head up in order to see, these are all indications of PTOSIS and should be addressed by an eye care professional. Older individuals whose vision is obstructed by age-related eyelid drooping should also schedule an appointment with their eye doctor. An eye care professional can discuss treatment options and establish if surgery is a good option. If you think you may be developing drooping eyelids, compare a recent close-up photo of yourself, more like a selfie, with one taken 10 or 20 years ago, or even 5 years ago, and compare it. This comparison will actually show how much the position of your eyelids has changed over time. I hope this video was helpful, and please, there is no home remedies to cure PTOSIS. It's just surgery. And thanks for watching this video. Don't forget to subscribe to my channel as I pleaded earlier on, and please help me share as well, since this video might be very helpful to others. You can also help me like if you find this video educative, and if you have any questions or suggestions, you can leave that in the comment section below. See you when I upload my next video. Bye.